Welcome to Navigating Your Health Today, featuring Dr. Deepak Shrivastava. Dr. Shrivastava comes to us with a wealth of knowledge that he is eager to share. Board certified in pulmonology, respirology, sleep medicine, gerontology, internal medicine, and physiology, we are grateful to have him on our team. Today he will be sharing more helpful information on how we can shelter in place safely with our family.
Welcome to the COVID-19 seminar. I'm Deepak Shrivastava.
Today's episode is by Julia Worrell, producer and educational director for CEA.
Today we are going to discuss COVID-19, common misconceptions and misinformation, and we'll try to separate the facts from the fiction. So the claim is that COVID-19 is just like the flu. Well, it is not quite. That's a big misconception, even among healthcare providers, that COVID-19 is just like another episode of flu, because we do get seasonal flu in the same season when the COVID is occurring. COVID-19 is dangerous. It transmits much more rapidly because of its genomic structure and its ability to attach to the receptors in human body. The mortality or the death rate of the seasonal flu is about 0.1%, which is given the situation and the fact that it affects so many people around the world, the mortality rate is much lower compared to what COVID-19 has done in a short period of time. The mortality is about 1% at this time and rising. So if you just look at that fact, COVID-19 is 10 times more lethal than the normal flu. So please do not take that information lightly. Claim is that the virus lives on certain fomites. Well, that's true. Let's examine it, because that's where most of the epidemiology and public health landscape is at this point, to how to prevent. These viruses can live on the inanimate objects for a variable period of time, and we'll see what some of these studies show by the experts. The virus, COVID-19, coronavirus, survives better on the hard surface like stainless steel and the plastics, less well on the clothing, fabric, and the cardboard surfaces. It can live on some of the surfaces up to 72 hours or 3 days. So we cannot assume that something is left out in the air and sunshine is depleted of the virus or free of the virus. Dr. Lloyd Smith, who is the expert at the National Institute of Allergy and Infectious Diseases, and an expert is how these viruses evolve and what's their natural history. He has recently reported that SARS-CoV coronavirus type 2, or COVID-19 virus, as we say, it can sustain up to 3 hours in the aerosol, which is basically droplets suspended in the air, up to 4 hours on metal surface like copper, up to 24 hours on the cardboard. And cardboard I would equate with all the boxes that we receive from the mail-in businesses, or the bags from the grocery stores for that matter, or up to 2 to 3 days on plastic and stainless steel, as we discussed earlier. And one can contract this virus through the particles in the air or after touching the contaminated surface or the objects. So how does it transmit, and what are the possible routes of respiratory infection? Let's look at this cartoon and spend a little time on it. So the person here with the orange color is breathing. This slide here does not say coughing or sneezing. It's exhalation and evaporation of the moisture from the nose and the mouth. That very function is enough to cause the virus to be airborne and aerosol be produced and be transmitted to their close contact, who would inhale the spray or the viruses in the air, suspended in the air, and will get infected. Now, if it is airborne in the surface and you are in closer proximity than 6 feet, one is susceptible to get the infection and then again inhale the virus. If we look at the fomite, so when the airborne aerosol settles down on a surface, here in this case, either on this table or on the laptop, and it is called fomite. And then once somebody will touch it, the fomite will get onto the hand if that's how somebody touched it. And then if it goes back and the person touches their nose or mouth or face, they are likely to get infected. So there are a variety of ways this virus is very easily transmitted. And that's why I think we are seeing a lot of problems that are happening, big areas of the infection like New York, because it's not only the coughing and sneezing as opposed to the popular belief, just the simple breathing can transmit the virus. So one has to be extremely careful. We have already looked at that it can live on certain fomites for a long time. So how do we take care of that? Routinely sanitize frequently touched points of contacts and objects. And some objects are obvious like doorknobs, but others are not. For example, credit card, when you make a transaction, the credit card has to be sanitized and wiped. Otherwise, it can potentially carry the virus on it and contaminate your wallet and of course your hand with the next transaction. And all it is waiting for is when you have an itch and touch your nose or mouth or face. So it is likely to catch the infection through the air if you are next to someone infected, then off of a surface, because we don't touch the surfaces as often as we breathe. So 10 to 12 times we are breathing on normal basis. And if one is infected, they are exposing the other person that many times to get infected. So cleaning the surface with the disinfectant and soap is very effective, because this virus has an oily coating, and when this oily coating is disturbed by the disinfectant or soap, a virus becomes disabled and cannot invade the human body. There are some people who still believe that if they do not have any symptoms, they do not have the virus. Well, that's wrong. Now we know more than ever. At least last week, a larger study came out which caused ripples through the country, and CDC went ahead and made the recommendation for people who are even asymptomatic to wear masks. It's about 50%, and my bias is that it is more than 50% people who are infected but do not have any symptoms. And they do contribute to the transmission. So if you look at the cartoon, which is attributed to CDC again, that here is the person who is infected. And again, as we reviewed some of the slides, people are social distancing from the infected person. Chances of these other people to get infected are much less. So social distancing has given us an advantage of about 75% reduction in the virus's ability to infect other humans from a subject. There is some math behind the social distancing, and I found it on one of the websites, borrowed with permission. If this person on day one is infected and social distancing is practiced, then at day 30, only 2.5 more people get infected with the coronavirus virus. If there is no social distancing, at the end of on day 30, there are 400 plus people get infected with the same virus. So clearly, if you see it, it doesn't take a rocket scientist to figure this out, that if you stay away from the range of the virus, which is carried by a person who is asymptomatic, supposedly, you will not get infected. And that's why the recommendation currently to wear the mask. And I strongly recommend that you wear the mask, especially when going out to the public places. The claim is that virus is only airborne. Well, the verdict is right now inconclusive, as the scientists are trying to find the truth about this virus. We know, as we saw in the earlier slides, that airborne transmission of the very small droplets that aerosolize through the sneezing and coughing, but we also saw that it is just through the normal breathing, and also the evaporation of the moisture from the nose and mouth can cause the infection. It can linger in the air for up to 3 hours. But there are experts who disagree, and their argument is that experimental aerosol in the lab is, the particles are designed much smaller as part of the study, and they remain suspended in the air for longer time. But this could be a false sense of security. In the middle of the pandemic, I would probably not agree with those experts, but that remains to be seen. Cough and sneeze particles are, according to them, the naturally occurring human infectious particles are heavier, and they sink to the ground faster, implying that they are not suspended in the air for longer period of times. But again, considering the contagious nature of this virus and the complications related to this virus that actually causes death in very short period of time, I think we should err on the side of the safety and use the mask. There is a misconception that is going around is when the temperatures change, the summer arrives and weather warms up, the virus will die away. Well, evidence is not conclusive so far. It has not been studied, number one. There was a study that was published in New England Journal of Medicine, but that study was done while the virus was studied on the room temperature, which is 21 to 23 degrees Celsius, or in our setting, perhaps 70 to 75 degrees Fahrenheit. So we understand that from the last endemic that occurred in 2002 and 2003 of the SARS, the stability of this novel coronavirus 2 is about the same. If we consider that, means we will not see any significant change when the ambient temperatures change during the summer. Well, that science remains to be seen and proven. In any case, at this time in human upper airway, the viral load can be extremely high, and it allows significant amount of shedding and transmission of the virus to the susceptible individuals, as we saw earlier. As we are watching the media and the data that the serious disease occurs in the elderly and they die more frequently than the younger people, that is actually a misconception and false. While it is true that the older people are infected and die with the COVID-19 viruses, young and healthy people are at significant risk themselves, because many times comorbid conditions may not be evident and not known. For example, I was thinking about a person who has diabetes but does not know about it. Elderly people who are living in the nursing home or long-term facilities, immune suppressed people with heart disease, asthma, diabetes, chronic kidney disease, liver disease, or just being obese, which unfortunately are many people around the world, are at significant risk of harboring the coronavirus and dying for it. CDC guidelines indicate, and we should review them, that clean and disinfect the surfaces that many people come in contact with: tables, desks, doorknobs, light switches, countertops, handles, desk, phones, keyboard, toilets, faucets, sinks, and use your imagination. Just know what are the surfaces that you are likely to touch during the course of the day and disinfect them. That will be very cheap, little labor intensive method to protect yourself. Washing hands often with soap and water for at least 20 seconds. And I tell you, my friends, 20 seconds is a long time if you will really religiously do it. Please do it immediately after returning home from a public place like a bank or the grocery store. It's very important. When in public, keep a distance of 6 feet between yourself and others. Many grocery stores and banks actually have put markings on the floor so that you can maintain a 6 feet distance. And most importantly, stay home. If you feel sick, you suspect that you're not feeling well, and contact your provider for guidance. So I'd like to thank you for listening to me. Knowledge of COVID-19 is still evolving, and this information may be obsolete by the time I finish this webinar. So please check all the media, all the reliable websites like CDC for updated information, and please do not touch the untouchables. Thank you so much.
CEA is a nonprofit organization that exists to address gaps in healthcare knowledge and help you navigate your health today. Thanks for listening, and please share.